Well, here at EuroPCR in 2018 in Paris, two very important trials will be presented or have been presented. Indeed, the spiral on medication trial, a trial where renal denervation has been compared to sham treatment in patients receiving antihypertensive drugs. The superiority of the device has been confirmed by this study of 80 patients. And another study more into patients with hypertension but not receiving antihypertensive drugs. A trial that used a dedicated ultrasound device, a balloon-based ultrasound device, which is called Radio Solo, also showed efficacy of the device, superiority over sham treatment. And these two, together with the recent publication in The Lancet, the spiral off medication trial, finally confirmed the proof of concept that indeed denervating the kidneys, reducing renal sympathetic activity, lowers blood pressure in both in patients not receiving antihypertensive drugs, but also in patients receiving tablets. Well, first of all, what is important for us and for the community, and especially for PCR, who is committed to further develop this field, is that denervation works. It lowers blood pressure in hypertensive individuals. And there are more investigations to come. Pivotal studies are ongoing. They will hopefully be completed 2019, 2020. We will then see how that develops further into an approval and commercialization of the products. But what is more important probably are the research topics. And these include identification of responders to the technology. This is very important. Secondly, we have to understand if there are any signs and parameters that help us to guide through the procedure in telling us we achieved significant nerve damage, we denervated the kidney successfully. And third, we have to understand how long the effects last over time. Is there functional regrowth of nerve, reinnervation of renal sympathetic nerves? These three topics are probably those which will drive future studies. The statement will not be published. It's more a commitment to the field and to further supporting the evaluation, scientific evaluation and the clinical development of these catheter-based approaches to treat hypertension. Well, it took some time after HTN-3 to be back on track. Actually, these three studies are very, very important for the field, for our understanding about hypertension. We have learned so many things about hypertensive patients, how they behave in clinical studies, what sham does with patients, how much adherence is an issue in hypertension. And we have to come up with new ideas, new concepts to treat the endemic hypertension around the world. The control rates remain unacceptably low, and we have to come up with new concepts and new ideas to get patients to control and to reduce their risk. And I think renal denervation is one of the approaches that looks promising at the moment, but more research has to come, and we will see how that finally adds to the armamentarium of antihypertensive approaches.